Good afternoon, everybody. It is 1 o'clock. It's Friday and it's Fertility Talk. Today we are talking to Dr. Tebogo Deo. She is from Fertility Center. It's in Pretoria, so Pretoria, Gauteng. And it's the first time we've got someone from Genesis on our Fertility Talks. And today we are discussing fertility preservation. So thank you very much, Doctor. Doctor, you are the director of one of the directors of the Genesis Fertility Center. And we thank you for taking the time out, because I know you guys are really, really busy. So thank you for taking the time out to actually do this talk with us. It's a very important topic because, it's something, if you don't know about it now, it could be too late. When you get 40, you get to 40 and you don't actually look at, preservation, fertility preservation. I'm going to hand over to Doctor, and you can just give us a bit of a detail about who you are, introduce yourself to everyone, and yes, let us know, talk to us about fertility preservation.
Thank you very much, Leanne. Good afternoon to everybody. I'm Dr. Tebogo Deo, as Leanne has introduced me. I'm a fertility specialist based in Pretoria, gynecologist, but I'm also one of the directors of Genesis Reproductive Center based in Erasmus Kloof in Pretoria in Gauteng. We're going to be talking and tackling the topic of fertility preservation today. I'm going to go on to give you a short PowerPoint presentation just to put it a bit in perspective, and then we can take short questions and we can discuss in a discussion thereafter.
Great. Doctor, are you sorted with the screen? The presentation?
We just need to enable the presentation again, Eliane.
Okay. Okay, so I think I've got you. There we go. So I think you should be ready to do it. There we go. Thank you for everyone who's joining us. Doctor just busy sharing a screen with us. Here we go, fertility preservation.
There you go. There you go. Okay. All right, we are going to be talking about fertility preservation. I'm Dr. Tebogo Deo, like I've already said, from Genesis Reproductive Center. Those are our contact details if you want to talk to us, reception at drdeo.co.za, or you can go to our website, www.genesisart.co.za. So there's different facets of fertility preservation. We can talk about the male or the female and embryo freezing, but for the purpose of today's discussion, I will focus mainly on egg freezing because there's a limited reproductive lifespan for women. So definitely the story of a biological clock is a factor for women. On the graph that I've shown you there, it is showing number of oocytes for different ages, so number of oocytes on the Y and the number of age on the bottom. And as you can see, as age advances, the number of eggs starts dropping. So why egg freezing? Because if you were to try and postpone childbearing, as you can see, the percentage of miscarriage, it goes up while the fertility goes down, and you have a sweet spot around 35 years old there. And this is the time at which we talk about maybe the point that we should seriously be considering fertility preservation. So the indications, we have what we call elective freezing, which is usually egg donation, or planned or social freezing. Social freezing, not a very nice term. We prefer to call it planned freezing, and or non-elective freezing, which can be done with oncofertility for people with diagnosed with cancer, breast cancer, ovarian, uterine cancer, because the cancer treatment can be toxic to the eggs, and other non-social medical conditions, conditions where a person is predisposed to premature menopause, lose weight, which is not what we're using anymore, and endometriosis, where you may have had repeated surgery. So why social freezing in particular, or planned egg freezing? We spoke about egg donation, okay? And the goals of planned egg freezing may be because career planning. We know that women, emancipation of women, we are also now in the boardrooms, and you don't want to take a break at the time when your career is taking a trajectory where so you can be able to go on with your career. And this also may give you peace of mind, especially where there is no suitable partner. You don't just want to grab the next guy that is around the corner because you are 35 years of old or you are getting older, and you just grab the next one. It doesn't matter whether he'll be a good father or he's got good genes, for that matter, to match your wonderful genes.
Yeah.
And when the mental stability as well. So when you're not ready for babies, you should not have babies, because especially with people who are career people, you may be predisposed to postnatal depression. So this buys us time for that mental stability when you are not ready. And also, when you have babies at the time when you are ready to have a family, the quality of life is much better. But I must bring to your attention that a lot of women who go for oocyte freezing do not go back for their eggs, because sometimes after they have done the egg freezing, they may now have spontaneous pregnancies afterwards. But these are studies that were done mainly in Australia and in the UK. So the situation may be a bit different in South Africa.
Yeah.
So you should go for counseling. And when you are in counseling, this is what we will discuss with you. As I already mentioned, the low return rate of women, that it's not necessarily an insurance. So that you have frozen your embryo is not a guarantee of a pregnancy. It is just buying us time, because what you give as the quality of your eggs is what will be used. It is a bit costly. It's similar to IVF. There's a risk of either hyperstimulation or poor response. And that is not necessarily because of egg freezing, but because of your de novo risk as a person. And we should discuss what happens to the leftover eggs once you have had the number of children that you want. When we will also talk about the survival rates of eggs at the center where you will go. Most centers in South Africa, we've got at least minimum 80% survival rate. And the long-term safety and follow-up of children that are born. At the moment, there's no data that shows that the children that are born from egg freezing do worse off compared to fresh eggs or from spontaneous pregnancy. And the pregnancy rate of egg freezing comes to about 70% conception as compared to cycle, and 40% live birth. So this is comparable to fresh cycles. Okay. How many number of eggs do you need? So to obtain one day 5 embryo, which is a blastocyst, this is what we would call a good quality blastocyst. So if you are less than 35, you need minimum 6 eggs. If you are between 30 to 40, you need 10 eggs. And this is the age after which we would discourage you to now try to freeze eggs, because as you remember in the first graph that I showed you, the risk of miscarriage is higher, risk of abnormalities. 42 to 43, you're looking at up to 16 oocytes that you need. And this is usually the group that yields less eggs. So you may make 2 or 3 eggs. You can imagine how many cycles you will need to make 16 eggs. So you need multiple cycles for this number of eggs. Therefore, the best age for freezing of oocyte is less than 35 years of age. So what about the number of eggs that you need for a healthy baby? In some, we used to talk about 12 to 15 eggs to get one baby, but now with vitrification, you need about 5 to 6 eggs for one healthy baby. This is for good quality young eggs.
Wow.
So what about non-planned freezing? So non-planned, we are talking about cancer treatment. Somebody has been diagnosed with cancer. We've seen that cancer now we're diagnosing in very young people up to the age of 21, 25. What happens? Treatment can be toxic to the eggs, especially chemotherapy. And if you've had cancer around the pelvic area, radiation may also be problematic. So you need about 2 to 3 weeks of treatment for egg or embryo freezing. So this does not necessarily delay your treatment that long. And if we don't have that much time, we can actually go and harvest the ovarian tissue and freeze that. And this is done before the cancer treatment, because as I've said, cancer treatment is toxic to the eggs. And then there are people who are at risk to premature ovarian insufficiency, or what we used to loosely call premature menopause. So if you have a family history of somebody who's had menopause early in your life, we would do AMH, serial AMHs, and once they start declining, then we need to start looking at freezing eggs. Young people with Turner syndrome, they also are at risk of this premature ovarian insufficiency. That means they reach menopause much earlier on in life. The issue with this is that you need maturity, because this is an adolescent and they are still young, most probably not sexually active, and you already should start talking about putting them on this treatment and freezing the eggs. And these people have got a risk of double the risk of miscarriage in general compared to the general population. What about you? When you are with the doctor, what should you discuss when you are freezing? You should discuss, as you can see there, how many are we going to put in the ice block? So the reason is because, like I've said to you, it takes about 5 or 6 oocytes to get one baby. So depending on the number of babies that you are needing, so we should put 5. So it's not actually an ice block like you see there. It usually will be in something similar to that, and it goes into a nitrogen dry gas canister like that, and equal number of times that you can thaw. So how many times? So if you've frozen 16 eggs, 5 in each and 6, that means that you've got 3 chances that you can thaw the oocyte. So should you get indeed fertilization the first time, that equals to possibility of 3 babies. Mind you, I'm saying possibility. It doesn't necessarily mean you will have 3 babies. No. Okay? The process that is involved, very much in vitro fertilization-like, except that you will take injections, and these injections will then elicit number of eggs, quite a lot. We would like you to make a lot, and this is why there's a possibility of hyperstimulation, but we are on the lookout for that. We screen you for that. Before we do that, we take you to theater, we do egg retrieval, that we do vaginally. There is no operation, you do not get cut, it's a day procedure. You will be in the unit for maybe about 90 minutes or so. Within 2 to 4 hours, you will be able to go home. The eggs are retrieved and they are put in an egg freezing machine, something similar to that. Thank you very much. I hope that
thank you. Thank you, doctor. That is actually, it's, you know, I think years ago you never heard of egg freezing, or you heard of it, but you didn't, there wasn't that, you know, importance of it needs to be done, you know, as soon as possible. It's important to have egg freezing, or not important, but it could help you in the long run. I'm actually just checking if there's any questions for us. If you have any questions for Dr. Tebogo, Dr. Tebogo is based in, for those of you in Pretoria, and I think it's our highest, most of our followers on Facebook are actually from the Pretoria, Gauteng region. So Doctor is at the Fertility Center, Genesis Fertility Center in Pretoria. If you'd like to get in contact with him, you can email it, admin at Genesis. Doctor, if you can just confirm that email address.
Okay, admin at Genesis. Otherwise, you just email our rooms directly at reception@drdeo.co.za, reception@drdeo.co.za. If you have any further questions or you would like to make an appointment, you can also call us at 012-367-4364, 012-367-4364. And okay. This is in Rasmus Kloof in Pretoria, Kloof Mediclinic.
Okay, perfect. You can also contact, they have a listing, a full listing on our site on fertilitysolutions.co.za, and you'll have all their details there. Again, if you have any emails, please, any questions, please contact us directly, contact Doctor directly, or you can also pop us an email. Thank you very much for joining us, Doctor. We hope to have many more of these talks with you, and hopefully over on Instagram as well. So there, ladies, you have it. The reason why egg freezing is very important, especially these days with, like you mentioned, with cancer. It's the younger it's cancer doesn't have age anymore, almost, or preferable age anymore, compared to years ago. It used to be, okay, only when you're 60, 70, then you would be diagnosed with cancer and stuff. So it is definitely very important. Have a lovely weekend, and thank you for joining us, Doctor.
I just also add that, especially for Christian young men and women, have to go and grab the next man or that comes around to just try and have your baby. You can talk to your fertility specialist, and we can consider what we can ask. Thank you very much, and have a lovely weekend to everybody. Bye.
Thank you very much, Doctor. Thanks. Bye.